What are the common barrier methods for contraception? When it comes to contraception, barrier methods are popular choices that help prevent pregnancy by physically blocking sperm from reaching the egg. They also vary in how well they protect against sexually transmitted infections. Let's explore some common barrier methods you might consider. First up is the male condom. This thin sheath is usually made from latex, polyurethane, or polyisoprene and is worn over the penis during intercourse. Male condoms are the most widely used barrier method and are about 85% effective at preventing pregnancy with typical use. They also offer the added benefit of reducing the risk of many sexually transmitted infections, including HIV. Next, we have the female condom, also known as the internal condom. This is a polyurethane pouch that is inserted into the vagina before sex. Female condoms provide a barrier to sperm and can help reduce the risk of sexually transmitted infections as well. With typical use, they are approximately 79% effective. Another option is the diaphragm. This dome-shaped cup is made from silicone or rubber and is inserted into the vagina to cover the cervix. To be effective, it must be used with spermicide, which can improve its effectiveness to between 71% and 88% with typical use. A healthcare provider must fit the diaphragm, and it should be left in place for at least 6 hours after intercourse. Similar to the diaphragm is the cervical cap. This smaller device fits tightly over the cervix and is also used with spermicide. It requires professional fitting and can be inserted up to 6 hours before sex, remaining in place for up to 48 hours. Its effectiveness is around 78%. Another option is the contraceptive sponge. This small, round sponge contains spermicide and is inserted into the vagina to cover the cervix. It blocks and kills sperm and has an effectiveness range of approximately 73% to 86% with typical use. You can find it available over the counter. Lastly, we have spermicides. These chemical agents come in various forms, such as foam, cream, gel, film, suppositories, or tablets. They are inserted into the vagina before intercourse to immobilize or kill sperm. Spermicides alone are about 79% effective and are often used with other barrier methods like condoms or diaphragms to enhance protection. While barrier methods can effectively reduce the risk of pregnancy and some sexually transmitted infections, they are generally less effective than hormonal or long-acting reversible contraceptives. Proper and consistent use is key to maximizing their effectiveness. It's also important to note that aside from male and female condoms, most barrier methods do not provide reliable protection against sexually transmitted infections. Therefore, condoms are often recommended for dual protection against both pregnancy and sexually transmitted infections. For personalized advice, especially regarding fitting for diaphragms and cervical caps, consulting with a healthcare professional is always a good idea. Understanding your options can empower you to make informed choices about your reproductive health.